Actually, my situation was quite unique. I visited Health City with my family about 4 months before. I accompanied my mom where she had spinal fusion surgery. So I became very familiar with these symptoms of lower back, issues. So when I started to be symptomatic of similar issues, I right away started to communicate with Dr. Sushil.
Mr. Jameel Ali came in with a common condition, what we call a lumbar disc prolapse. But he was somebody who had this very early on in his life. Now, normally you would find this sort of a condition in maybe the 4th decade, 5th decade or upwards. And in fact, overall, the incidence of that condition is coming down, in more earlier age groups.
I was trying to keep fit, so I started the gym. And then, I was a bit too aggressive and I lifted some weights, badly. And then I started to have this leg pain that started to get progressively worse every week from the left thigh all the way down to my toes.
He had severe pain. Every time he moved, he tried to walk. He had severe pain that was associated with numbness. He also felt a little weak down his leg. Now, unfortunately for him, while he was receiving some kind of medication, he was on rest for this treatment. He had a fall and he injured his ankle as well. So now, he had these two problems that he was dealing with. So while his ankle was relieving, was getting better, was improving, he still had this persistent pain.
I was just very impressed by the level of professionalism and the human touch that Health City, puts into the product that they market, that they sell. So yes, I did do an MRI locally. However, I can even compare and contrast when I did a second MRI upon arriving here. Just the resolution of the images were far superior than the resolution of the images I took back home, and that was just a matter of 2 weeks apart.
And he underwent what we call a lumbar microdiscectomy. It's a very simple surgery, minimally invasive procedure, a small 1/2 inch incision on the low back, or maybe less, and we just go and remove the part of the disc that's bulged out or that's pinching the nerve. So it's just freeing up the nerve, and which gives almost instant relief.
Every single aspect of what they do and who they are, it is indeed world class. And I can tell you that, from my personal experience, yes, it's very easy to appreciate what they say. It's all about, it's a very truthful form of marketing that they exercise.
I still remember he said his leg feels so much more lighter. And because he had this pain for so long after the operation, he now felt that the leg was unusually lighter because he was not used to his leg being normal for so long. So he had almost instant relief from severe pain.
The package, the products that they sell, which is healthcare, it's at a fraction of the cost and it's world class. So it's like everybody wins.
If you reach a point where the nerve is starting to get damaged, and the evidence of that is by weakness, loss of sensation, and sometimes when it's very severe, there could be bladder bowel issues as well. So if somebody has reached a point where it's causing significant weakness of movement, significant loss of sensation or bladder and bowel involvement, now that's something that needs to be treated early. Nerve issues, once a nerve is fully damaged, you cannot reverse it. You can prevent it from getting damaged further, or you can reverse it when it's partially damaged, but not when it's completely gone.
I think to myself that I will be making a 100% recovery. So I would recommend, listen, if any of my family members or loved ones, anybody, I think for even the slightest thing, they having any health issues, I would say, listen, just get on the plane and get to Health City. My interactions would have started with Mr. Matthew Sami, right? And I just communicated to him via phone call as well as email. Listen, Matthew, I've been talking to Dr. Sushil, and I think I want to come up to the Cayman Islands and pursue this avenue, for healthcare. And immediately, in 1 to 2 days, everything was coordinated, whereby the international healthcare representative, Ms. Keela Stewart, right, would have, you know, communicated with Matthew. My itinerary, they assisted even with, you know, getting the US funding in place, you know, for the wire transfers and stuff. Itinerary, flights, it's all prepared, it's all executed way in advance. So they know when you're coming, what you're gonna do. There's no guesswork at all. You know, not for a moment in my mind did I suspect that these people are unsure, you know, in the handing over process from department to department. It was done seamless. They are actually perfecting this, and it's all centered around the patient, the customer service experience. It's very important to them that we have a successful procedure or, you know, a successful remedy, and then recommend to our loved ones, you know, who might be in distress, that listen, this is a one-stop, you know, shop basically to get better.